Hi, so this is my first video using my selfie stick. Okay, as you can see, I'm doing a lot better. I'm in a lot better mood. I still don't feel good. My tumors are growing back quickly and very annoyingly. I hate it. I mean, what can you do though? Quick update. So, I was having really bad anxiety about seeing that spleen doctor. And then on top of my anxiety, I was getting really paranoid because I felt like the spleen doctor himself, I don't want to say he was disrespectful, but he was like really rude. And I felt like he just hated his job because he was like, boop, 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 boop. Get the fuck out. You're getting your spleen taken out. That's just that. And then his nurse was just kind of like weird. And then when they didn't answer my questions, I just felt that was so disrespectful. So really, I just think they both were really rude. And somebody commented on here and said, oh, I think that they should have a little bit of bedside manners. They should have a lot of bedside manners, especially when you're dealing with someone's life and you're not flipping burgers at McDonald's. I mean, okay, that's a great example. When you go to get a burger from McDonald's, a $1 burger, and they like, here go your food, you get offended and you're like, damn, all I wanted to do was buy my fucking burger. What's the attitude for? So if a doctor and his nurse that works in surgery with him or anybody affiliated with a hospital does not show you a little bit of respect, how can you say they should only have a little bit of bedside manners? They should have a lot of bedside manners. You are trusting them with your life. You're definitely trusting them with your body. It's a serious thing. So it was just too much. It was just really disrespectful, and it was just too much. And it was too much for me to take in, and then that's why I was just like, went crazy, started crying, lost my mind for like 2 days. It was crazy. But here's the crazier part. So after that happened, I went and Googled best splenectomy doctor in Cleveland Clinic, and only one doctor came up. And then I had to do a little bit more research to find other doctors. But the one doctor that came up, he was like a 5-star rating doctor, extremely good reviews. So I had called his nurse, and she gave me his email because he was gone. So then I ended up calling one of my plastic surgery doctor, not for my leg. So he tells me the same guy's name. So then I already had the second opinion doctor who I went to on Monday, which went really well, and he was really nice. His name is Dr. Bartholomew, and he's really nice, and he works at the Cleveland Clinic, and he works with people that have what I have, Clepidotrononi. So if you have Clepidotrononi and you go to the Cleveland Clinic, you should definitely go to Dr. Bartholomew, and if he can't help you, I'm just looking at my eyebrows, y'all. I did this one higher. Oh my god. Okay, if he can't help you, he will point you in the right direction. And he's so nice. His nurse is so nice. His whole staff is so nice. So yeah, I'll recommend them. But I was talking to him about this spleen and this whole situation. So I mentioned to him the guy that I found on the internet that my plastic surgeon recommended, and he was like, he is really great. He's like, he's a great doctor, and he's a friend, and just all this great stuff. He was like, he will really care and look into your case for you. So he said that he was going to let him know that I was coming because I'll be there in like a little over a week. So when I got home that day, that doctor emailed me back. His email was so nice. It was so refreshing. I felt like I was back in the plastics and dermatology or with the vascular anomalies, whatever, people. Meaning, I felt like I was, even though this was only an email, I felt like this doctor really cares. He really likes doing his job. He's not burnt out doing his job. He cares about his patients. He's not going to take on a patient if it's not important to him. That's just how I felt from the email. We sent like 3 emails back and forth. So this is the craziest thing. So he said he's seen somebody, he's familiar with KT, and he said he is going to see someone this week or something like that. with KT for a hernia, which is funny because I've had a hernia before, and they told me here in Toledo, oh, it'll go away. So that kind of makes me wonder, like, should I go get my hernia checked out? But so he said like an enlarged spleen for people with KT is normal. And he's like, I'll take your spleen out if you want me to, but I don't think you really have to. And he's like, I looked at the literature, and when you get there, I'll look at the scans and we'll talk about it. So that's crazy. Like, what if I would have just ignored my mind and went with this fucking jackass that was so fucking rude and so fucking disrespectful, had no bedside manners, his raggedy ass nurse was just as fucking rude, got my spleen taken out, and has so many complications, when there's a possibility that I don't even need the damn spleen taken out. And I really hope that I don't need the spleen taken out. And I told him, like, I really don't want it taken out. I said, but if it has to be done, it has to be done. And I told him, like, I don't even know you, but I feel so comfortable with you already. But just like he was saying, your spleen isn't even fully enlarged. It's borderline enlarged. So there's not even a risk right now. So I'm just really happy. And I'm telling you, that just, like, it just made me do that. Like a sigh of relief. I'm just really happy. Now, I am in excruciating pain, though. Seriously. I probably don't look like it, but I am. My whole side is red, all the way down to my lower stomach, like pelvic area. It's red. My incision scars, red. Basically, everywhere where I just had surgery is red. And you know what that means? And it's warm as hell. And I can smell something. That means it's growing back. It's coming on down. And that is, like, so irritating. But you know what? I'm just at a place right now where it's like, that's irritating as fuck. But what can I do? I can't do nothing about it. So I'm just going to see my doctor and see what he says. Maybe they'll laser it down. Maybe they'll embolize it. I have no idea. But I'm not going to worry about it. I'm just going to put it in God's hands. And I'm just going to try to build myself up and just keep my cool. And understand that although people are fucking bitches to me because I have a birth defect, that is their problem and it's not my own. So, fuck them. If you can't accept me, piss off. I have to do what is best for me, and I have to think about myself. And I just have to make myself happy. There's only one me. I'm here by myself. Well, I got my dog, Giselle, who's eating a bone. And that's it. And I only have one life. And whether something fatal happens because I have KT, I can't even, like, think about that or worry about that. I just have to live in the now. And that's what I'm going to do. So, that's it, you guys. Thanks for watching this video. And I'm attaching this other video to show you, like, how freaking red the thing is and sore and freaking painful it is. It's so annoying, I swear. Sometimes I just want to, like, stab KT. Oh, I also went on this thing called Disease Finder or something like that, where you can type in your location of where you have whatever it is that you have. There's only me and 3 other people in Ohio with KT. And it's only, the one of them is 9, and the other one is older. But it's like so many people with KT in Europe. So what? Okay, sorry. So what European ancestor screwed me over? What the shit? How dare you? I'm about to turn into Tyra Banks. I was rooting for you. And you screwed me over. I don't know. Anyways, whatever. Yeah, I'm going to attach the other video. And until next time, you guys. Bye-bye.